Last week, we looked at a Canadian serial killing Santa Claus who, for a variety of failures in the system, operated nearly 10 years and took 8 lives that we know of. This week, we look at another of Canada's most prolific serial killers who also targeted a very vulnerable population and also took 8 lives that we know of. There could well be more. Elizabeth Wettlaufer, killer nurse. She's Canada's only known healthcare serial killer. You'll soon see why we say only known one. In 2007, Wettlaufer would be hired by Crescent Care, a long-term care home in Woodstock, Ontario. While there, she struggled with substance abuse and alcohol addiction. She showed up at work drunk, was found passed out in the facility's basement during a night shift, and made medication errors that would see her suspended 4 times. She was finally fired after 7 years when she gave the wrong medication to a patient, nearly causing a death. Little did they know at that point. After her 7-year stint at Crescent, Wettlaufer went from job to job. There was Meadow Park Care Centre in London, Ontario. She lost that job after checking herself in for drug rehab. Then there were temp jobs, which she was fired from for either stealing medication or making more medication errors. All the while, she was writing poetry about how she wanted to kill. She tried to confess several times to friends and even to a lawyer who told her to keep it secret. Then she would confess to staff at CAMH, a mental health and rehabilitation facility. CAMH would immediately notify Ontario's nursing regulator and the police. She would confess again to both. Her nursing license would ultimately be stripped and she would be charged. Her method of murder was to inject insulin into patients. It's hard to detect purposeful insulin overdose, so she thought she would get away with it. Also, insulin was not tracked at the time in the way narcotics are tracked, so it was accessible to her in large quantities. She was ultimately charged with 2 aggravated assaults, 8 murders, and 4 counts of attempted murder. She was given life without parole for 25 years for the murders. She would say that all of the patients she targeted had some form or level of dementia, and that is one of the criteria she used in targeting them. She chose them because they could either not report what she was doing or would not be believed if they did report. She also relied on the fact that nursing home deaths were rarely treated as unexpected, and so the coroner would rarely review them, adding another layer of buffer that allowed massive insulin levels to go undetected. And she went undetected because the systems were never designed to detect her, nor were they designed to ensure that potentially lethal drugs, not only narcotics, were protected for abuse and misuse. Additionally, the deaths were never treated as unusual, never reviewed. This means Wettlaufer may not have been the first. She may not have been the only. There may well have been others. As you'll see in future videos, healthcare serial killers are a real phenomenon. It's real and it needs to be something that the system design is able to protect against and detect, though that can be very difficult. More importantly than Wettlaufer herself, an inquiry was called to determine how a nurse was able to kill 8 patients, try to kill 4 others, and injure many more, and what changes could be made to prevent a repeat of these incidents. Several of the changes identified, there were 91 recommendations, were to track insulin in the way that narcotics are tracked, better control and surveil medication rooms, fewer long overtime shifts for nurses, and better review of deaths in hospitals and care homes. How well did they improve care for elders after Wettlaufer? Well, the COVID-19 pandemic shed brand new light on how elders continue to be mistreated in long-term care homes. The Canadian military called in for help, exposed a whole host of other issues that are for another video on another day. For today, we say, deal with it. As of February 2020, the province has only implemented 18 of the 91 recommendations. So deal with it. Deal with it. Not a single other elder should die for lack of care, negligence, or gaps that we should have fixed long ago. Before we go, as we try to do, let's leave Wettlaufer behind and remember the people who are the heart of this story. They are Clotilda Adriano, 87, Albina de Medeiros, 88, sisters who Wettlaufer committed aggravated assault against by injecting them with high doses of insulin in 2007, Michael Priddle, 63, Wayne Hedges, 57, Sandra Towler, 77, Beverly Bertram, 68, who Wettlaufer tried to overdose, Maurice or Mo Granite, 84, Gladys Millard, 87, Helen Matherson, 95, Mary Zurowinski, 96, Helen Young, 90, Maureen Pickering, 79, James Silcox, 84, and Arpad Horvat, 75, who she murdered. Clotilde and Albina were sisters, 2 of 11 siblings in their family. Clotilde was a mother of 2, grandma to 5, and great-grandma to 3. Albina left behind her husband and a brother when she passed. Michael was a married man with 2 children who died at home with family. He was a devout Maple Leafs fan, poor guy. So much so that when he passed, mourners were encouraged to wear Maple Leaf gear to his funeral. Wayne was survived by his parents and one of his 4 siblings. We don't know much about Sandra, but Beverly was living at home in Ingersoll, Ontario when she encountered Wettlaufer. Mo was a longtime mechanic and automotive body tech from Tillsonburg, Ontario. He was the father of 2 daughters and a son. He had 5 grandkids and 11 great-grandkids. Gladys was a widowed mom of 2 who grew up in Nova Scotia. She was a longtime member of the Knox Presbyterian Church and a member of the Rose Rebecca Lodge in Woodstock, Ontario. Helen Matherson was a widowed mother to 2 sons and a longtime United Church member from Ingerkip, Ontario. She had 3 grandchildren and 4 great-grandchildren. She is described as someone who was very kind, though very quiet. She was always willing to lend a hand and never had a bad word to say about anybody. Mary is somebody we don't know a whole lot about as well. Helen Young came to Canada from Scotland as a bride shortly after World War II. She and her husband enjoyed camping and travel, and she continued traveling after her husband passed. She is described as a true sturdy Scottish lass who did not hesitate to speak her mind on any and all subjects. Maureen was a widowed lady from Tillsonburg, Ontario, and James was a Second World War veteran who had 6 children. His daughter advocated for change after his murder was discovered and again after the pandemic revealed additional issues, slamming the government for their continued understaffing of the homes, which leads to continued neglect of the elders. His son described him as the best father in the world. He was also described as caring and kind, one of the nicest men you could meet. Arpad was a married father of 2 who was living at the Meadow Park facility in London, Ontario. He owned Central Tool and Die in London and was a member of the Hungarian club there. He was a hard worker who cared for his family and liked to joke around with friends. He liked hunting and traveling and owned 2 farms. And it is for all of these elders, for all of us, for all of our elders, that the government needs to wake up and deal with how our elders are treated in long-term care homes. It's essential. It's not going away. None of us are going away. And so it's time they dealt with it. Thank you for listening. And until next Saturday, have a great week. If you're enjoying these videos and want more, don't forget to subscribe and turn on your notifications so that you don't miss any videos. Thank you for watching. We really appreciate it.